movements in order to perform the joint mobilization. In this video, we are going to make a comparison between the bones of the spine on the model here, the plastic model, as well as on the patient. I am going to show you how you can palpate the K12 rib, that is the one we saw in the previous video, and by following the profile of the rib, we can get to the D12, which is the dorsal vertebrae. You can see it also on the model. There's different colors for every single tract of the spine, and we can follow all the spinous processes. From there, we can find the D12. Once we find the D12, we can find L1, L2, L3, and we can have this global vision, this full picture of the lumbar tract. This is just an alternative way of finding the L5. We can actually start from the L5, or with a cupped hand on the sacrum, we can see that our middle finger falls in a sort of gap where we find the spinous process of L5, and we understand that that's the last one of the lumbar vertebrae. These dimples here are very clear on our patient, and they correspond perfectly to the sacroiliac joint. On this patient is very easy to find, but if we had a person with a different morphology, then we could hug the iliac crest like this, as I'm showing you on the video, and then by moving the thumbs towards the sacrum, we will see that they will fall right on the PSIS, the posterior superior iliac spine, or the PSIS. Our patient is on a lateral recumbency, and now we're going to see the mobilization of the lumbar tract. As we said before, the patient is on the side lateral recumbency. It's quite a comfortable position for those who suffer from LBP, which is low back pain. It is important to have a support under the head of the patient, a pillow, in order to hold the cervical tract as neutral as possible. Then our hold will be like this. We take the arm of the patient that is on the bed and we place it under our arm. Then we make a sort of torsion of the thorax of the person till we feel the movement of the lumbar spinous process under our fingers. After doing this rotation, we place the hand of the patient on his own elbow. We bend the leg, the superior leg, as you can see here on the video, and then we will focus the movement right on the lumbar vertebrae. We then place the focus on the lumbar ones, and by putting our cranial hand right under the arm of the patient, and with the thumb we will grab the spinous process of the lumbar vertebrae we want to treat. Then the thumb of the left hand is placed on the spinous process, and then the other hand grabs the spinous process of the vertebrae below, always with a hook grip, so that we can counteract to strength. And as you can see here, the thumb holds the vertebra and the other hand rotates the spinous process. Of course, we must help ourselves with our elbow and with the weight of the body. There is a drop, that's how it's called. It's called a drop and a rotation, so that we can use our weight in order to perform a rotation of the spinous process. This can be done on all the lumbar vertebrae. Once we locate the lumbar tract, we can move on all the vertebrae that make it. This joint mobilization is recommended for all those situations of pain or local dysfunction. For example, for people who have limitation in bending, or all those people who cannot reach the tip of their feet. It happens quite often that a person comes to the studio and tells us, I cannot tie my shoes anymore, or I cannot grab something from the floor anymore. And that's due to a tension of the lumbar tract. It can be used also as an initial treatment, to be followed by more advanced treatments, of course. Of course, this can be used as an initial treatment, and then we can move on to treat the muscles or any other dysfunction. Here we have our patient in a prone position, and what are we going to do now? Let's be extremely cautious. It's something that we never need to forget, because as we can see here, there is a strong lumbar lordosis, and patients that are in prone position, they may suffer from it, or also patients may have come to us because they have low back pain. It is also difficult to palpate the lumbar spinous processes if we don't put the pillow under the belly. With the pillow, we do two things. Number one, we make them feel more comfortable. Second, we are able to better palpate the spinous processes. I am showing you now the joint mobilization that is very similar to the thoracic vertebrae. We use this kind of grip that is very comfortable to grab the spinous processes. It's exactly the same movement you have seen in the previous videos when we spoke about the mobilization of the dorsal vertebrae. Now let's see another joint mobilization of the lumbar tract, always with the patient on a prone position, and we see here a different grip. For this kind of mobilization, we have to grab the iliac crest of the patient on the anterior part, which is the ASIS, anterior superior iliac spine, and the psis. Then with the other hand, we actually place our thumb on the spinous process we want to mobilize. As you can notice, we are touching the left side of the spinous processes of the vertebrae. I am actually showing you that the hand that is under the psis and the ASIS is moving, whereas the other hand is rotating the spinous process. There is one hand, there is the cranial hand, that is the one that touches the spinous processes, whereas the other hand lifts the pelvis. We have seen that we can do this mobilization also on the thoracic tract, but what do? We make minimal rotation of the pelvis, and the smaller the rotation, the more we focus on the lumbar. The greater the rotation, the more it will be on the thoracic vertebrae. Let's now move on to the palpatory anatomy. Well, by now we should be experts, since we have already focused on the lumbar vertebrae. Now we're looking at the dimples on top of the sacroiliac. I'm pointing them out. First, we indicated the posterior iliac crest, and then we contoured the limit. We can place one hand on the sacrum, as we can see, and the other hand, using the strong hold of the tenar eminence, we place ourselves on the psis, and with a double action we can mobilize the sacrum. The hand that is on the sacrum holds the position, whereas the other hand with the tenar eminence pushes laterally. It sort of opens the sacroiliac, and we know that the sacroiliac doesn't really have a wide range of motion. But with our hand open and with the finger stretched, we push in oblique direction. Exactly in the oblique direction. We don't really need to fear that it can be painful, because it is usually never painful. With the left hand you fix, whereas with the right hand you're pushing down and in the oblique direction. It is important to notice that my body is perpendicular to the sacroiliac I want to treat, because in this case, I'm not moving just my arm, but I'm actually helping myself with the weight of the whole body in order to mobilize the sacroiliac joint.